Hello everyone, you are all welcome to lecture number 1297 and today's topic is ankylosing spondylitis, its causes, symptoms and treatment. This ankylosing spondylitis is chronic inflammation in our spine. When I say spine means it is from your base of the skull up to the end of that is tailbone, or sometimes we call it vertebral column and commonly we call it backbone, and it is in segments, and this is the condition of chronic inflammation, and sometimes it is called as axial spondylitis arthritis. Axial means vertical, so it starts from your base of the skull and it goes up to the end tail of your spine, and this condition it can start from adulthood, even slowly it will grip. And here your genetic factor, family background, family history is very important, because I am not going to discuss deep inside anatomy and medicinal chemistry because it is for common people. Just I will tell you that what happens, there is very specific type of gene mutation, that protein, and that protein will slowly start first mild inflammation, then acute inflammation, and once it is full blown it is called chronic inflammation. When you are reaching to that condition starting from your adulthood, maybe from the age of 30 or 40, slowly your posture of your body will start going down, and it will be having a rigidity, deformation, and a restricted movement. The movement will be stopped, and in chronic condition it goes up to that extent that sometimes you are totally on bed, paralyzed, or in chair. You cannot walk, you cannot stand, you cannot sit, because of this ankylosing spondylitis or axial spondylitis arthritis. And if you remember, I always used to say one thing, and I will go on telling, that the mother of all these conditions, or your most of the health conditions, deformation, a lot of diseases, autoimmune disease, all these are linked to only one thing, that is called inflammation. And at any cost, please control your inflammation. Once you are successful in controlling two things: one, inflammation; second, oxidative stress and common stress. Oxidative stress and inflammation, if it is controlled, at least you can lead your life normally, and you will not be suffering from different type of diseases where your bones, ligaments, spines, they are deformed, they are damaged, they are deteriorated. And for that, you have to change your lifestyle. You have to check and balance your environmental condition, in which environment you are living, densely populated, crowded area, very dirty area, and of course your dietary habit. What type of diet you are taking? I am always telling, please shift to anti-inflammatory and antioxidant diets. Those diets or nutrients or food which you are eating, make sure that they are rich in these components, in these compounds. So the rich source of anti-inflammatory compounds are color or we can say deep colored fruits and vegetables. If I tell the name apple, watermelon, melon, mango, orange, grapes, papaya, so many like that. They are the best food to control the inflammation and to stop, to reach to chronic inflammation. And here I am going to show you some of the images, but before that let me show you here. Actually in this way is like that. This is your head, and here it goes from here, and then these are your spine, and these are bones of the spine, and it starts from here, and the whole is called, that is a vertebral column. It reaches up to here, and lumbar and cervical and pelvic, all. I'm not going to tell you that, but only I'm interested that how this spine and these spaces where this one will be having chronic inflammation, and this chronic inflammation is going to make these two bones to fuse together, and once they are fused together, these two, if fusion is taking place, here the flexibility of this bone, that spine, is lost, and once it is lost, you are rigid. Your mobility will be lost totally, and you will be deformed. You might have noticed lot of millions of the people, and if we are calculating on the basis of percentage of people who are suffering, it goes from 2 to 3% globally. And in Asia and Africa, 4 to 5 million people, they are suffering from such type of deformation of their spine, vertebral column, backbones, because of this spondylitis, that is ankylosing spondylitis. So I am going to show some of the images. So here there is very clear image of your spine, that is your vertebral column is starting from your skull base and reaching up to your tailbone, and that segments, they are counted 1 to 7, and then 17, 13, like that, and they are known as vertebral column, but specifically they are called lumbar vertebra, cervical vertebra, like that. And once they are involved in chronic inflammation, so name is given according to the spine, that bone. Here you can see normal condition where the posture of the body of a normal spine or backbone is flexible, posture is flexible. But the second image you can see where the spines are fused due to chronic inflammation, then his posture is rigid. He cannot be straight again in axial position. It means that's why in some of the books they refer it as axial spondylitis, because axial means it is vertical. So your vertical position cannot move up and down. And very clear picture is given here that because of the fusion of the two of the spines due to chronic inflammation in the space, and that is a really very, very serious condition where you are bedridden or you are in wheelchair. It is zoomed in large photograph of your spine, very clear picture, the one which is shown with the red color in between two spine, that is bone. It is in the condition of chronic inflammation, and now you cannot move because the two of the bones are fused, but on upper and lower side those are free of chronic inflammation. So because of that, at least you will be having only sharp pain, but you can manage. In the case where all these many of the bones of your spine, they are fused, maybe 4, 5, 6, 7, then your mobility will be totally stopped and you will be on the bed. This is chronic condition CT scan, very original. Chronic inflammation is shown in all red color. It means whole that area of spine that is called backbone is totally in chronic inflammation, and all the bones are fused and you are in very bad shape. You are just like we can say vegetable, and you will be only paralyzed in the bed and nothing else. We can't do anything. This is very, very dangerous condition. So here in the form of summary, I have given some causes and symptom and how to handle or treat it. And number 1, ankylosing spondylitis, that is AS, is a type of arthritis, and that mainly affects the spine of our body. And you have seen all the images of spine and then backbone and their fusion, everything very clear. Although other joints can also be affected, it is a type of chronic inflammation disease, and that causes the vertebra in the spine to fuse together, leading to the loss of flexibility and mobility. It's very clear that once your spine is involved in chronic inflammation, because of that your spine bones are fused together and your flexibility and mobility is totally checked, and you are disabled, deformed, and you cannot have your very right posture of axial and bending and again recovering. No, you will be having stiffness. Number 2, causes and risk factors of ankylosing spondylitis, that is called AS commonly. Number factor 1 is genetic. If anybody is having this AS, it's clear indication that he or she must have family history, because it goes in family, generation to generation. And for that risk factor, one particular lipid and protein in the gene is responsible, and the name of that particular protein is HLA-B27. If anybody who is having that percentage of genetic marker, that is HLA-B27, means he or she is having high risk, and they should be careful. Careful means drastically reduce acidic food and shift to anti-inflammatory food like 80% fruit and vegetables. Number 2, those who are suffering from autoimmune disease, means where your own normal autoimmune system fighting cells, they start killing, destroying, damaging your normal cells. So those who are having that disease, they are at high risk of getting AS. Then number 3, environmental factor. If I say environmental factor, means in what circumstances you are living. Always in tension, always in stress. If I say stress, is a 2 type of stress. One is oxidative stress, means where during the oxidation, reduction, reaction in your body, whatever free radicals are produced, they are not neutralized, they are not destroyed, then you will be having oxidative stress. The other stress is that stress, good and bad. Sometimes stress is good also. I am going to deliver one lecture on good stress. Means it will motivate, it will encourage you, it will give you hope to work hard. That is called positive stress. And negative stress means always depression, negative mood, and thinking that everybody is against you and you are going to be destroyed by people, you have enemy and sky is falling. That is your negative stress. So please reduce your first oxidative stress and then negative stress. Then number 3 is symptoms of ankylosing spondylitis, that is AS. Number 1 is early adulthood symptoms. It starts from early adulthood. Even from the age of 25, 26, you will get the pain, back pain, hip pain, joint pain, neck pain, sometimes fever, sometimes laziness, sometimes weight loss. So all cumulative symptoms, they are pointing you, directing you towards that road of getting AS. That is one early symptom, back pain, neck pain and stiffness. Number 2, limited mobility. Once you start getting this inflammation in your spine, slowly your mobility will be reduced. You will not be flexible. You will not be much mobile. That is indication, early indication. Number 3, joint pain and swelling. Always we will be having joint pain. Sometimes we will be having swelling in ankle, in knee. All this, they are all indication that your body is under acute inflammation, moderate inflammation. Inflammation actually is a very complex thing. Even if you are in tension, you have inflammation. If you are overweight, you have inflammation. If you are irritated, you have inflammation. So, I mean, it's a lifestyle. Inflammation, if anybody who can control his or her inflammation, body inflammation, and oxidative stress and body inflammation, believe me, lot of publications, thousands, not hundreds, are coming now that it is the mother of most of the diseases, that is inflammation. If you are successful in managing the management of inflammation, you will be healthy. And you will be on the road of longevity. You may go up to 80, 90, 100, like that. So number 4, fatigue and fever. I have already told you, this is one of the symptoms. You will get always tired. Sometimes you will get headache. Sometimes you will get fever. All these symptoms are there. And then come to number 4, that is the treatment of AS, ankylosing spondylitis. What are the treatments? The first treatment is medical history. You have to go thoroughly, generation to generation, what is his or her medical history, father, grandfather, great-grandfather, and great-great-great-grandfather, all definitely factor is there. Number 2, that is physical examination. If I say physical examination, means now lot of tools are there to find out the flexibility of your knee, joints, ankle, or the doctors, they know it, they will do. And then number 3 is that is MRI and CT scan. It will give the cell by cell very clear picture of inflammation in the spine. Then number 4 is medication. And doctors used to prescribe, that is anti-inflammatory, non-steroidal drugs, and also immune suppression drugs are also there, because sometimes autoimmune problem is also there. Then number 5 is go for physiotherapy. Very good and experienced physiotherapists are available nowadays, and those physiotherapists, they know every joint, every ligament very well. They will understand and they will do physiotherapy. It is also very effective. And then last but not least, regular exercise. Be active. Whatever situation or condition is there. If you are moving, you move. If you cannot move, you crawl. By any means, go on moving. That's all. Note, as it can, you have a further increase of the risk of deformation, stability. You can have the risk of getting osteoporosis and uveitis. Uveitis means it is sometimes your retina, cornea, and all those area of the eye can have chronic inflammation, and you may lose your eye. side. That condition of inflammation of eye problem is called uveitis. I'm going to deliver one lecture on uveitis, how people are losing their eye because of this chronic inflammation. That's why I'm calling inflammation is the mother of all. And finally, whatever circumstances there, don't feel depressed. Be active. That's all. So with this I will stop. Thank you very much for watching the lecture.